Hi, good afternoon. I am Jomar Visperas and I am your nurse for today. For today's video, I'm going to perform the emergency management for uterine atony, uterine balloon tamponade. Okay, the number one procedure is gather all need materials for making uterine balloon tamponade. Follow the institutional protocol. First, I will gather all the materials needed in this procedure for easy accessibility. First, I will introduce myself to the patient and explain the procedure. Ma'am, I am Jomar Visperas and I'm your nurse per day. These are some materials that we needed. 2 sterile gloves, 1 Foley catheter, 1 povidone iodine, and 1 saline solution for irrigation and 50 cc syringe. Next, explain the procedure to the client. Tell her that it will be uncomfortable, but she has to relax. Take a slow, deep breath and stay still. The rationale for doing this is to relieve the anxiety and apprehension. Ma'am, we will be doing emergency management for your postpartum bleeding by making uterine balloon tamponade to stop the bleeding. I will make a balloon and inflate it inside your uterus to stop the bleeding. I will encourage you to take a deep breath and relax it. Next procedure is encourage the client to urinate. If the patient cannot urinate, catheterize the patient. The rationale for doing this is a full bladder can weaken contraction and delay the separation of the placenta. Ma'am, if you can stand up to urinate in the bathroom, I will assist you. But if you feel dizzy, I will offer you a bed fan or I can insert you a catheter to help you to urinate. Next, ask the patient to lie down on the bed on her back with legs apart and drape the client. The rationale for doing this is to easy visualization and provide privacy. Ma'am, I will assist you to lie down on the bed with your legs apart, and I will drape the part that I will only expose. Next procedure is start intravenous infusion and incorporate 10 units of oxytocin in a liter of intravenous fluid. Ma'am, I will do intravenous infusion to restore your blood loss. I will mix the medication into intravenous fluid to help your uterus to contract. The next procedure is wash your hands and put antiseptic solution over the woman's perineum and then put on your sterile gloves. Next, I will wash my hands first. Assuming that I will wash my hands and then put antiseptic solution in the woman's perineum. Put antiseptic solution in the perineum of the woman's perineum. Put antiseptic solution. Or assuming that I will put antiseptic solution and then put on my sterile gloves. And then next is I will put on my sterile gloves. Assuming that this is a sterile gloves. Now that I put on my sterile gloves, the next procedure is inflate the intrafoley catheter balloon with sterile room temperature of 0.9 sodium chloride until it can be seen in the cervix, typically around 200 to 300 or maximum of 500 ml.
Okay, I will start making a uterine balloon tamponade by inflating the intrafoley catheter balloon. I will insert a deflated balloon. I will insert the deflated balloon, then I will inflate the balloon by saline solution up to 500 ml until it can be seen in the cervix. Next, please imagine that my patient has a vagina, then insert it. After you insert it, put on saline solution and inflate it. Remember, maximum of 500 ml. This range is 50 cc. Okay, as you can see, the polycatheter has inflated. So, continue, insert it. Saline solution and that, and tape it in the thigh of the patient. I don't have tape, so that assuming that, so that's it.
Pwede ka rin gumamit ng condom balloon tamponade, pero hindi ko na ginamit kasi ang nasa guideline ng SAS is yung lang ginamit ko na Foley catheter, so yun lang ang sinundan. Next procedure is tape the end of the Foley catheter at the thigh of the patient. The rationale for doing this is to apply the gently traction of the catheter. And now I will tape the catheter at the thigh of the patient there, and then connect the drainage port to the drainage port of the catheter to the drainage bag to monitor the amount of blood loss, assuming that this is the urine bag, like that. And then the rationale for doing this is to monitor the amount of blood loss. The next procedure is remove gloves and wash your hands. And the rationale for doing this is for infection control. Okay, the next procedure is remove the gloves and wash your hands. Next procedure is monitor the vital signs and the urine output, fundal height and vaginal bleeding and amount of blood loss. The rationale for doing this is to monitor if the client is experiencing hypovolemic shock. Okay. Next is I will continue to monitor the vital signs of the patient, the urine output, the fundal height and the vaginal bleeding, and also to monitor the amount of blood loss. Okay. Next procedure is document the procedure, and I will document the procedure on the nurse notes, and if the bleeding did not subside, I will refer the client to the CMOC facility. The rationale for doing this is to provide accurate data in the care of the client.